no doctor, no dentist. You know, you have to travel 30 miles to get to the doctor.
We have 0 doctors in the county. We don't even have an ambulance service.
The scary part is if something serious happens, like an emergency, the nearest hospital is like 30 miles either direction.
It could be up to 45 minutes to an hour before you get an ambulance here.
A lot of times patients in this community will often choose between the cost of their medication or paying a light bill.
I feel forgotten about. Like, I feel like people don't, care about what we have to face.
We've had several mothers to have their babies in the car due to the fact that they couldn't get to the health provider that they need to.
We're people, we're human, we need food.
Retaining physicians over time is becoming increasingly difficult too, as there's a shortage.
To get anything worth anything, you have to go to another county.
It's a 30-minute drive to the nearest grocery store.
Went to bed, I had to get up. I was airlifted to Memphis because there wasn't a bed available.
Get a little weak sometimes if we don't eat properly.
If you can get them in a car and take them yourself, your chances are better than waiting for the ambulance.
It's a quiet place. And it's really not for young people. There's nothing here, nothing to offer you. It's really like a retirement place for senior citizens. In this area here, I would like to see more jobs here, more opportunity for the young people to come back. Been here all my life in Inequity County. Yeah, my husband had a heart attack. I really didn't know exactly that that's what was happening. He just was telling me his stomach was hurting, and he said he needed to go to the doctor. We do have a little small clinic, and it takes you like 15 minutes to get there, just a little stop-in place. But if something major, they fly you out of there to Vicksburg or Jackson or Greenville, which is 45 miles to Greenville and about 50 to Vicksburg. It was kind of scary because I hurried up. I was driving fast, which I drive fast, but it was kind of like, it's kind of a little scary. I got him there in time, so when I took him to the doctor, they told me he was having a heart attack and to do not go back to the house to get anything and take him on to Vicksburg. So when that's where I took him and told me he had 14 days to live. And exactly he did die 14 days later.
Our country is divided. In many areas, when it comes to health care, it's the haves and have-nots. And nowhere is that more true than in the Mississippi Delta and Appalachia. From blues to bluegrass, from crude oil to coal mining, the cultural traditions in these regions are as rich and diverse as the natural resources. But many of the voices that live here are crying for help. Our investigative team poured over millions of lines of data. The scope of our analysis went deep. What we determined, these two regions need help. When compared to the rest of the country, people are dying more and earlier. Overall, our analysis found residents of the Delta and Appalachia die younger than the average American. A disproportionate number of babies struggle to live to their first birthdays. The CDC labels much of these two regions America's diabetes belt. These areas reach 17 states, 35 million people, 240,000 square miles. Some of these voices feel forgotten. Others look for solutions, for ways to bridge the great health divide.
There is discrimination against Appalachian peoples. There is discrimination against people who are poor and live in these areas.
I think there's a complex story to be told about health inequities within the Appalachian region.
As a daughter, I was petrified, so it's like my life went full circle.
People have this saying that time is brain. The sooner we can get you treated, the better your outcome.
I knew we didn't have a hospital, so I thought, please let this ambulance get there.
Where we live at is a very remote area in a small county in the Upper Cumberland Plateau area.
We're a small town. We live in a small community. Everyone does for one another. We treat each other like family. Everyone's pretty tight-knit around this area.
Tell me about the hospital that you used to have there in Jamestown and what happened to it.
That hospital came around in the 60s, and it probably had, I would say, 50, 60 beds, but it could take care of emergencies. It had an emergency room, small surgical unit. It could take care of, what you needed to either keep you there for a while or ship you out.
When did it close down?
It closed down in June of 2019.
Why?
The owner that bought it, from what I understand, was maybe a poor manager of managing hospitals, and they did not have the funds to buy the supplies or staff the hospital.
What did losing that hospital mean for your community?
The closest larger hospital is going to be anywhere from 30 to 60-minute drive.
So how far from your house is the closest hospital?
Right now, the closest hospital to me is probably at least a 45-minute drive.
So the night before, I had actually made dinner. I had just had a evening at home, and it happened early in the morning. Around 2 or 3 a.m. is whenever she started showing signs. And my little brother called my mom, and then he called me, and he said, "Can you please come up here? Something's wrong with Granny." I said, "What's going on?" He said, she's not acting right. She can't talk. She's not answering any questions. I said, "Did you call Mom?"
They called me. I was working. She kept telling me on the phone, "I'll be all right, I'll be all right." She's not wanting to go to the doctor if she don't have to. We come up there, she was in the bathroom, and her bathroom's rather small, so we couldn't really get to her. I remember asking her, "Granny, do you know what today is? Can you tell me your name? Can you smile? Can you do anything, that show us that you're okay?" And she was just she was out of her head. She was just kind of slouched over. And Mom said, "We need to call the ambulance." I tried really hard not to cry because that would scare her. I knew we didn't have a hospital, so I thought, please let this ambulance get there. So I just kept saying, "Please, God, let everything go as good as it can. Please don't take her away from me. Please don't take her away from our family." And they came down. The paramedic that came in and assessed her felt like that she was having a stroke. And he loaded her in the ambulance, told us right away that they were going to call a helicopter. And the helicopter met her about 10 minutes from our house. But the helicopter had to come out of Kentucky to fly her to Knoxville, Tennessee.
So while you say there's a hospital 45 minutes away, a hospital to treat a stroke patient is 2 hours away?
Yes, you're going to be looking Knoxville, Nashville, Chattanooga. I was very overwhelmed with emotion, especially whenever the helicopter landed and they were transferring her, because she was just like, she was a rag doll. At that point, she had no control over her body. She was out of her mind. She couldn't speak. She couldn't do anything. And I just knew this could be the last time I see my grandmother alive. This could be it.
What do you remember from that day?
I couldn't see, couldn't talk, don't remember seeing nothing.
Looking back, how fortunate do you feel?
Very unfortunate. Dr. Clark, our doctor in Jamestown, said if we'd have a hospital, I'd never had to leave town.
What could it have been if it had been inclement weather? What could it have been if our 3 ambulance trucks were on another call? How lucky was she, and how many people are going to get that lucky in the future?
The fact is that same fear strikes hundreds of thousands of Americans across the country. 800,000 people suffer strokes every year, many just like Lottie Crouch, in rural areas, far away from the specialized care they need quickly.
When it comes to strokes, minutes matter, don't they?
They do. So people have this saying that time is brain, which is perhaps a little bit jarring of a statement, but it basically means that the sooner we can get you treated, the better your outcomes are going to be. And that's not just in terms of mortality, but also in terms of whether it turns into a big stroke or a small stroke, whether you're left with any trouble in the long run or whether you recover really well. So really, minutes do matter for stroke, and that's why particularly in rural groups, we worry about getting to those hospitals on time.
Strokes cut off blood flow to part of the brain. The sooner that blood flow is restored, the more the brain can heal. We decided to look at the scope of the problem. Along with our partners at Kaiser Health News, we mapped out stroke centers and analyzed how long it takes residents to reach that important care. Our findings reveal nearly a third of people who live in the Delta region live more than a 45-minute drive from a certified stroke center, the places with the long drive shown here in bright red. Some areas have particularly limited access. 42% of all residents in Arkansas live more than 45 minutes away from one of those centers. In Mississippi, more than 30% of residents have at least that long of a drive. In Louisiana, nearly 20%.
In stroke in particular, every minute is crucial. And a difference of a few minutes can mean the difference between walking out of a hospital and not. But now we're at a point where we're starting to see whole areas of states lose access to care. And so for strokes and other things where you need care really quickly, that can be really crucial.
You believe people in rural areas are dying or having worse outcomes because of a lack of access?
Absolutely. Across the country. From stroke, from heart attack, pregnancy outcomes.
As she described in detail what a lack of immediate care means for stroke victims, we started to think of it like a puzzle. The pieces have to fall perfectly into place for patients to survive. And for many families, the pieces don't fit. Their outcome is different than the story we told you in Jamestown, Tennessee.
That goes all the way from someone recognizing the symptoms, to making the call to EMS realizing it's a stroke, to getting to the right hospital, to getting the right treatment.
And the facts seem to show the systems in place right now often don't work. To help show the magnitude of the problem, take a look at this map. The darker the purple, the higher the stroke death rate. We found more than 80% of the counties in these regions have rates above the national average. Dr. Joint Maddox says there are a number of factors in these regions that lead to higher death rates, including overall health indicators such as diabetes and access to preventative and emergency care. And she says in many areas there aren't strong enough links between large hospitals with specialized care and smaller hospitals that are often the first stop in an emergency.
We can't put a trauma center in every corner. That's not economically feasible. But we can have systems in place so that when there is something that happens, be it a stroke or a heart attack or trauma, that we know how to get people the best care that we can. And we shouldn't be leaving it to chance. And right now, unfortunately, in lots of areas, it gets very much left to chance.
Oh yeah, Dr. Beach saved my son.
What'd you say?
Dr. Beach saved my son.
He saved your son's life?
Yes, my daughter wouldn't be here today without Dr. Beach.
Get in your car, call the ambulance, they'll come and get you or haul you away. It's one of those things when you're living out here in a rural place.
An emergency arises, it can be difficult.
Certainly use more specialty. Any doctor in town would be good, even, a nurse practitioner would be good.
Oh yeah, Dr. Beach saved my son.
What'd you say?
Dr. Beach saved my son.
He saved your son's life?
Yes, my daughter wouldn't be here today without Dr. Beach.
What's this town like?
There's not much to do here. When I got here, there were several industries that are all gone. Most people are either on Medicaid or they're poorly insured. A lot of the ones that are more successful actually go out of town to work. We have steel mills really not too far away that are good jobs, but otherwise in town there just isn't much, and we're about to lose another big business. Hardee's closed, boom, one weekend they decided they were gonna open again, and our Pizza Hut went bye-bye and everything. And then kids, there's not much for kids to do here. I mean, if they're not involved with school sports, there just isn't much going on. You know, it's a simple country town.
Cheryl Crow's the big name?
Yeah, she's here fairly often, not as much as she used to be. And she's been good to this community. She's helped put in a pool for the kids, so that's one thing we have.
People are proud of her?
Oh yeah, definitely. I think it goes back to her being such a nice person too. We have morbidity and mortality like nowhere else in the state. This is one of the 2 poorest counties in the state, and our infant mortality is the highest in the state too. So, I mean, we have issues, you know.
You don't have the doctors to treat the issues though?
Not always, no.
How hard is it with access to doctors and health care that you need in a town like this?
Extremely hard. There's no specialist in Kennett.
Right.
You know, we have Dr. Beach.
The hospital closing had a big impact?
Huge. You know, I used to cover call for the hospital 24/7 for quite a while.
So what happens if there's an emergency?
I guess we would go to Piggott. That's the closest hospital.
Tell me about your practice, where you work out of, how many days, each office, that kind of thing.
Okay. Well, I was exclusively here for a long time until the hospital closed, with needing sort of to branch out to get to people, really. I started a clinic in Haytime, Missouri. We also have an office in Campbell, Missouri, which is about 20 minutes the other direction.
And then you're here?
I'm here the rest of the time.
And are you in Arkansas too?
I go to Piggott Hospital, so I have my Arkansas license, yeah.
Okay. So you're working in 2 states?
Yes.
To fill the need?
The closest pediatrician's about 40 minutes away. Sometimes the road even closes because of flooding, so you have to take these detours on these little country roads to get there. Certainly not ideal. When I got here, there were 3, and the other 2 retired, and they just didn't have any success recruiting.
You're it?
I'm it.
You're the only pediatrician?
Yeah. And the closest obstetricians are 40 minutes to over an hour. You know, we used to deliver 500 babies a year here. Sometimes emergently, we've had babies delivered in parking lots.
There's a doctor shortage.
Yeah, definitely. We used to have cardiologists, ENTs, we used to have orthopedics, we used to have all those things. And then once the hospital closed and they started leaving.
So how busy are you?
I want to say the yearly is about 14,000 visits.
You see 14,000 patients a year?
Yeah.
There's no way.
Yeah,
really?
Yeah. Me with 2 nurse practitioners now. It used to just be me. We do get critical things here. I've had cases of things that are only 1 in 40 in the world. You know, St. Louis is sometimes jokes with me and says, can you send us somebody with just something simple?
Do you send people to St. Louis?
Yeah, that's my top children's hospital. They are very accommodating.
But that's quite a drive.
Yeah, it's 3 hours.
Why is it a negative, a big negative, and potentially dangerous not to have more pediatricians closer by?
A lot of people end up in family practice offices. And no offense to family practitioners, they fill a special void. But they're not pediatricians, the training's completely different. There's a lot of things that only a pediatrician would think of.
Well, my daughter, she's got severe cerebral palsy. She's 22, but she's the equivalent of like a 6-month-old. She can't talk, she can't walk, she's fed by G-tube because she can't eat by mouth. So when she has something wrong, she can't tell us what's wrong. She started crying, and it was nonstop, the throwing up, the crying. Something was clearly wrong. You know, it's not just your typical everyday cry. Instead of just giving her medicine, sending us home, he tested, and he found out that yes, her bowel was twisted. She needed flown out, but there was a storm and all flights were grounded, and they couldn't fly her out, so they literally had to do emergency surgery, bowel surgery on her here at this hospital.
And were they prepared to do that?
Well, they got the job done and saved her life. That we were very grateful for.
But now that hospital's closed. So if you needed something like that now,
it would be a bad situation.
So what do you do?
I guess.
Pray.
Yeah, exactly.
Pray. I came up here like 9 o'clock in the morning as soon as they opened, and I'm like, something's wrong with my child. They examined him, thought it was viral, just need to go home and, monitor. Well, it got progressively worse, and I took a video of him.
Where does it hurt? Huh?
My ear.
Up in your head?
Yeah.
Okay, well, why are you doing your neck so weird?
I don't know.
Huh?
I just can't raise it up that good.
You can't raise your neck up very good.
No.
Okay.
Well, Dr. Beach wasn't even coming in the office that day, but when he saw it, he told Lori, he's like, you tell them to get up there now, and I'll be right there. And he examined him, and he was like, here's the deal. He's not emergent, but you got to get to a hospital now. Now. And because we were like, well, can we go home and, pack a bag? He said, yes, as long as you promise me you will be gone from Kennett by 5 o'clock. This was like 4 o'clock. He's like, yes. And we went home and we packed and we drove to Le Bonheur. And we were, hospitalized for 5.5 months.
5.5 months you were in the hospital? What would have happened if you would have waited?
He would have died. Because Hayden, was pretty much in respiratory failure. Acute flaccid myelitis, AFM. It's been in the news in the last couple of years. It's, one of those rare 1 in a million type things.
He's still struggling several years later, but had we not acted, we would have probably lost him.
People in Kennett have it tough, but in about 1,000 communities, things may be even worse. The government tracks doctors and where they work. We extracted that information and put it on a map to see the places in our country where doctors are few and far between. Our analysis has a dire conclusion. The counties in red don't have enough primary care doctors to care for the people who live there. The government calls them shortage areas. More than a quarter of those areas are in the Appalachia and Delta regions. You'd need nearly 600 doctors just in those areas to fix the shortage. The data shows Pulaski County, Illinois, Robertson County, Kentucky, and Issaquah County, Mississippi haven't had a primary care doctor, nurse practitioner, or rural health clinic since at least 2010. And the doctor shortages go beyond primary care doctors. The Delta region, that includes parts of 8 states, more than half the counties don't have a pediatrician. Across the country, more than 40% of the counties don't have an OBGYN. And that lack of access contributes to health disparities. Remember, without Dr. Andrew Beach, these 2 Kennett, Missouri residents say they would have lost their children.
Why do you stay?
My heart was in rural medicine to start with. I actually have a PhD doing cancer research as well. I originally intended to become a pediatric oncologist. Taking care of the kids of a community seemed more important to me. And so I started, and I've never left. And so things happen in rural America that are sometimes surprising and shocking, and that you lack the resources to cover, but you make it somehow.
You believe there is a relationship between food access and health outcome?
We are what we eat is a medical fact.
We have obesity. That leads to diabetes, high blood pressure.
A lot of kids won't get a meal when school gets out.
And we feel that our people in our communities are just as important as anyone else. We just don't have what we need.
This is the only grocery store that's have here in the city of Durant.
Where right now it is hard for family members to get food.
It's a 30-minute drive to the nearest grocery store.
A dire need for fruits and vegetables and some meats that we couldn't get.
The only people that gonna be left in these small counties are the one that's too poor to move out.
Things were really bad when they were younger.
One Christmas, we didn't really have a real Christmas, but I made sure that they had, we had hot dogs. The dessert, I made something with Jiffy cornbread mix and some jelly. My kids always thought that it was fun food. My kids haven't, but I've gone without food before.
So how much do you receive in SNAP benefits?
It was about like $346. I had to make them stretch. I wasn't able to get meat or the fresh vegetables. There was a lot of ramen, a lot of mac and cheese. You feel like a failure to them, especially because, you know, I am on disability. I would love to be able to have a job. And I feel bad enough for getting benefits. And I just feel like a failure as a mother.
But Brianna Talbert is not alone. Her county has just 51 employers. The median commute time for workers is more than 39 minutes. About 20% of adults under the age of 65 are disabled. Before 2020, food insecurity impacted 10% of all U.S. residents. Experts think that number has at least doubled since the pandemic.
The majority of households exhaust their benefits in the first couple of weeks of the SNAP benefit month. So that means the SNAP benefit isn't carrying them through the entire month. Now, if it's designed as a supplement, maybe that's the way we want to think about it, right? It's not designed as the full deal necessarily. But for the 40% of households that it is the full deal, that means it's really not a supplement, it's really, you know, their primary food source.
The Federal Supplemental Nutrition Assistance Program, or SNAP, is also a challenge because it's sometimes cheaper and more convenient for families to eat unhealthy food.
Turns out that for that family of four, they have to spend roughly about 13 hours a week in food preparation, or 2 hours a day, roughly about 2 hours a day to meet the dietary guidelines underlying the SNAP benefit.
Many families face multiple issues: a lack of money to buy enough healthy food, but also access to a quality grocery store. We analyzed nearly 34,000 stores that accepted SNAP benefits across the Delta and Appalachia regions. What we found, nearly 2/3 of them were gas station convenience stores, discount stores, tobacco shops, or liquor stores where fresh food is limited. Data shows 6 counties don't have a single grocery store that accepts SNAP benefits. Issaquena County, Mississippi doesn't have any stores where people on benefits can buy food. 2 hours south, Jefferson County, Mississippi only has 2 grocery stores, but not everyone can get there.
Tell me just about your story, like what you do and how you got into it.
My family is a healthcare family. My mother was a nurse, my sister's a nurse. So in my family, it's kind of what you do. So I just felt like I had a purpose, and I think I can fulfill the things I need to do by being a nurse practitioner. Our town, we don't have a lot of industry here. Our elderly population is kind of dwindling. A lot of people live out in the rural areas and they don't have transportation. We don't have public transit here. So a lot of, especially the elderly and disabled, they depend on family members to transport them to and from.
When you look at Jefferson County, the life expectancy in Jefferson County is about 6 years lower than the national average. Does that surprise you?
No, it doesn't. We don't have a lot of options, a lot of choices. You know, we don't have Whole Foods stores, we don't have fresh vegetables. When you can't afford to eat healthy, then you eat what you can. And, you know, eating healthy is important. Eating healthy, having good, fresh vegetables and adequate food is important. If you can't afford it, then you're gonna go without.
Just so I have it, and when I'm writing the story,
Mari Gallagher.
Mari, not Mary.
Mari, like
Mari.
safari.
Like, okay. So how long have you been in this?
Well, I started out as a community development practitioner, working to help make neighborhood markets and
quality of life better for residents. You know, that was a long time ago, but I found that without good quality data and information, it's really hard to make strategic decisions and to really make a difference. So I always had a strong foundation in the research world. I went out on my own so I could create more metrics that actually measured things that mattered and measured them more precisely.
Is anyone doing the research that you're doing? Anyone else? Or are you it?
So we popularized the phrase food desert, if you've heard that before. We didn't come up with that term, it was used in England a long time ago, but we developed the first block by block way of assessing food deserts. I don't know that there's another entity that does exactly what we do, because we do the research and then we also help with the solutions. You know, we're there in the beginning figuring out if it's feasible. We're there at the end evaluating, did it make a difference?
You believe there is a relationship between food access and health outcomes?
We are what we eat is a medical fact, and we all do need to eat as part of the human condition. So hopefully 3 healthy meals a day. Many of us don't have those healthy meals. We're eating something probably if we're continuing to live, but we might not live well and we might not live long. Or as long as we would. Your food environment, the kinds of foods you eat, it gives you your life energy. It moderates whether or not you can fight off certain kinds of diseases. It's critical.
Why would a business want to accept SNAP benefits?
3 reasons. Money, money, money. There's a lot of money in SNAP, and there should be a lot of money. There are a lot of people who are missing meals because they cannot afford them, or they're missing quality meals. They're going to the mini mart gas station and getting something that's there because they're really hungry. One problem, though, is not all stores meet the low standards to be in the program. So there's 2 problems. One, standards are too low, and the second problem is there's no compliance to make sure that those standards are met.
To accept food stamps, most stores need to have at least 3 different food varieties in 4 major categories: fruits and vegetables, meat and seafood, dairy, and bread and cereal.
Most SNAP benefits are redeemed at very decent quality grocery stores. Let's say it's 80%. The problem is that 20% of the benefits are redeemed someplace else, and when you're doing these field assessments, I will go and look at all of these SNAP stores and go in and see what they're selling. And unfortunately, a high concentration of fringe SNAP retailers, we call them fringe.
What is a fringe retailer?
Well, there's 2 kinds. These are classifications or codes that we came up with: mainstream and fringe. A mainstream store is the kind of place that it can be small, but it has to have the kinds of healthy foods that would support a healthy diet on a regular basis. So a fringe store is not inherently bad. It offers convenience, but if it's your primary source of food, chances are over time, your diet and your health will suffer. I saw a laundromat one time that was in the SNAP program. They had this little kind of dumpy laundromat and then a little table it was just a little card table with some stuff that they sold, accepted SNAP. One convenience store, it had little gambling machines in there. People were in there smoking. They had no real food. I couldn't buy a bottle of water. I could get a bottle of wine or a 6-pack.
Our team went undercover in the Delta to see what food was available in fringe stores. We found little to no fresh fruits or vegetables or refrigerated meat. Most of what we found, canned. One store had a few peppers and a moldy lemon, the only signs of fresh food. We also found expired eggs. As we went down the aisles of rural mini-marts, gas stations, and dollar stores, we found shops selling karaoke machines and advertising lifelike baby dolls, all taking government dollars without offering much when it comes to nutritious choices.
That's the problem. Can you choose? If you go to a big grocery store, you have a choice. The problem is in some of these markets where these fringe SNAP stores dominate, it is very hard to make a choice.
Here's where things take an interesting turn. We wanted to find out why the federal government hasn't pushed stores to offer more choices. What we discovered, a 2014 law passed by Congress and on the books today, actually strengthened the requirements for stores. It forced them to have more healthy food on the shelves. The important change, instead of requiring just 3 varieties of food for each category, the law required 7.
This was an achievable improvement in terms of pushing stores to offer more, and our members wanted that.
When we started asking questions as to why the change was never made, here's what we found out. When the USDA put the law into effect, there was specific wording many lawmakers and convenience stores said was impractical.
They wrote them in a way that nobody understood or thought made sense.
Stores couldn't count things like bacon and deli ham as two types of food, just one, since they're both from the same animal. In a category like meat, the options for getting 7 choices into a small store run out pretty quickly. So in 2017, Congress pulled its own mandate until the USDA fixed the wording. But to date,
it seems like Congress wanted to fix it, but we're waiting for years for something to happen and nothing's happened.
That's exactly right. Everybody agrees this ought to be fixed, but we'll have to wait for the Department of Agriculture for that.
Don't expect too much now and be patient because it's very little here. And if you're from the big city, whew, I just say, wow. I grew up in this area myself. I'm from Wilcox County. So even when I was small coming up, it wasn't a whole lot here, but we had 3 grocery stores. And now there's no grocery store at all. This area has never had any industries. Wilcox County once was the poorest county in the United States. A lot of people are not aware of that, but it was once the poorest. We started off just visiting homes, going seeing our senior citizens and trying to find out whatever we could do to help out. And we saw the need getting a little bit bigger, so we figured it best to try to start a food bank. Donations started coming in with clothing and stuff like that, and it was just so big till we had to get a bigger building. This place we're at now, it was once a grocery store, so now it is the food bank. Mostly everybody that comes here is on a fixed income to no income. We serve over 19 different towns. I don't care where you're from. You get here, if I can give you something, I'm gonna give you something. We have 2 gas stations here, no 3. So if they were selling vegetables and fruit, that would be a blessing. But they don't, they don't. They might have canned vegetables, milk and cheese, something like that, but there's no fresh stuff there. So it's just the food bank itself going on right here, just the food bank. We're able to give them potatoes and, tomatoes, and we've been blessed with a 3-door cooler now so I can have dairy stuff. I know a lot of them come here and they'll call me later when we have a drive-by giveaway, and they'll say, thank you so much, because I don't know what we would do if the food bank wasn't there. So those kind of, when you get calls like that, it just makes you want to do more, And I wish I could do more.
But most days I go home and I feel like I've done some good for someone. I think in the Delta as a whole, just looking at the whole Delta, everyone is very family driven. At points in life, it's family. It's the birth of a baby, you think family. It's the death of a family, you think family. It is a marriage of the family, you think family. And life has gone on. I think
our census is somewhere around 11,000 in Indianola. But we draw people now from Greenwood, Greenville, Cleveland, Belzona. We have a large catchment area. This clinic has been here 60 plus years. We have a lot of physicians and nurse practitioners here in our town. There are 7 physicians, 5 nurse practitioners.
What is it like being a doctor here?
It is stressful, yet rewarding. We're practicing medicine in a place we never thought we would be practicing medicine. But most days I go home and I feel like I've done some good for someone.
And your specialty is?
I'm family medicine, but I have a women's health fellowship and I do operative obstetrics, so I take care of cradle to grave.
I mean, there are not a lot of doctors out there like you.
There are a lot of doctors in the country like me, not in the state of Mississippi.
Why is that?
A lot of it had to do with malpractice. Back before I came back, there was a malpractice crisis in the state and tort did not exist. And so lawsuits were frivolous and Mississippi was known for awarding large amounts to people. And so a lot of doctors who did what I did quit doing it.
In rural communities, a practice like yours or what you do is probably critical.
I think so, because when we start talking about access to care, I had a patient come in 15 months ago, and she was my patient, and she came in with a placental abruption where the placenta was tearing away from the wall of the uterus and she was bleeding, and she was 27 weeks pregnant with twins. Because we do what we do, we delivered her babies and we stabilized her babies, and Jackson was able to come in the ground ambulance and pick up her 2 babies, and I still take care of them to this day.
If you wouldn't have been here, if what you do would not have been a service provided here, what would have happened to those babies?
They would have died and their mother would have died. They would have bled to death.
And if she would have been in another rural community, that might have happened?
Exactly. We have lost the access to obstetric care in rural Mississippi. There are very few of us. There's some in Greenwood, some in Greenville, some in Cleveland, but driving from here to Jackson, which is 88 miles, there's not a single person who does OB between here and there.
How far were you driving?
45 miles. I was going to the woman's clinic in Clarksville.
How long a drive was that, an hour?
Yeah, it was like an hour.
So you're driving an hour away to get care?
Yes.
How did you first meet Dr. Patterson?
The second miscarriage. It was in March of 19. And so I called my doctor that I was seeing, and he told me to wait till Monday. And I was like, this thing can't wait till Monday because I can't handle this pain. And so I ended up coming to the emergency room here at the hospital. And Dr. Patterson was the doctor on call. And so she was like, I don't know if this baby's gonna make it. You know, she started to explain to me why was I having miscarriages, because nobody knew. And so I was all right after that. And she was like, if you decide to get pregnant again, just come to me. You know, I'll see what I can do. So a couple of months after that, I got pregnant again. I came to Dr. Patterson. And she said, Jaconia, you're gonna have to have a cervical cerclage because that's the only thing that's gonna hold these babies. Everything turned out good. I have 2 healthy babies.
If you wouldn't have had her input, you may not have any babies right now.
No, I would not have not one baby.
Why is it hard to recruit and keep doctors in a rural area?
I think there are a lot of reasons. I think that the Delta's remote. People think that we're remote. People are afraid of the lifestyle. It's a different lifestyle, but I knew that going in. Some people don't like the lifestyle, some people don't like the liability, but I see it as a way to help protect our state. I think that we've gotten away. What I do was what rural areas used to do.
Morning, Doc. That's a nice pig you got there.
Yeah, that's what they tell me.
I tell people all the time when I wrote my personal statement for medical school, I said I was going to be Doc Hollywood. And for anybody who knows who Doc Hollywood was, he was Michael J. Fox, great character, who wrecked his car, ended up in a small town, and ended up delivering babies, doing surgery, you know, all these things, and got paid with chickens and pigs and cows. Granted, I don't get paid with chickens and pigs and cows, but I feel like there is a need for well-versed, well-trained physicians in every specialty, especially family medicine, internal medicine, OB, to be in these areas to protect our population.
Are you Doc Hollywood?
I am. I can deliver a baby in the morning. I'm taking care of a hospice patient right before I came in here. This morning I got called to help resuscitate a baby who wasn't breathing well. It's what I do. I never know kind of what my day is going to hold, which I like.
Is more of you what is needed?
I think more well-trained physicians is what is needed. And it doesn't mean that they have to have full operative privileges at a hospital for C-sections, but they need to know what to do in case of emergency.
The residents in Robertson County, Kentucky have no Doc Hollywood, no one to see for an emergency or even a routine checkup.
How many doctors are there in Robertson County?
We have 0 doctors in the county.
How many pediatricians are in Robertson County?
We have 0.
How many nurse practitioners?
0.
But later this year, Robertson County might be getting its own Doc Hollywood. After seeing our reports, Greater Cincinnati healthcare company Next Direct decided to invest in this rural county.
I was flipping through my phone like I always do and saw this article that it said, Kentucky County has no access to health care. So I opened it and read it, and I read the story, and it just made me sad. And the owner was sitting there, and I said, hey, what can we do to help?
The company plans to open a primary care clinic in Robertson County with a doctor, and the county might be getting an ambulance. Robertson currently relies on neighboring counties to provide ambulance services. It can take 45 minutes for an ambulance to even arrive. Next Direct says it's also working on a plan to provide an ambulance dedicated to Robertson County.
I think it's wonderful. I have an elderly mother, and she has had a stroke, and you just never know when you're going to need an ambulance or services any time of the day or night, and I'm just so thankful to have this.
Our reporting across the Delta and Appalachia found many more solutions to the great health divide. The IGA in Salyersville, Kentucky is one of only 2 grocery stores in the county.
It's a very competitive business, even though there's only 2 in McGoffin County.
Some people are driving a long way to get here to get fresh food. And it can be tough to keep shelves stocked with fresh food in rural areas where margins are even tighter. Here's where the creative solution comes in. The Mountain Association helps grocery stores install solar panels and found out about this store.
They shoot for stores in regions that electric rates are a little higher than normal.
Now they're putting panels on this store with a projected cost savings of 25 to 30% on electric bills.
The bill's normally about $17,000, $18,000 a month, so it's a good chunk of that.
During the pandemic, organizations stepped up when even more people lost access to food. In Ashtabula County, Ohio in 2020, this was the line of cars waiting for food. Chicago-based researcher Mari Gallagher calculated if the lack of food was spread out amongst everyone here, no one would eat for more than 2 weeks. But to help, the Ashtabula County Food Bank helps coordinate getting food to 24 pantries in a county where grocery stores are few and far between.
So people, that's where they have to go. And obviously some of that is more than 10 miles or 15 miles or so.
And uniquely, they help 20,000 people with their Farmers to Families program, bringing fresh produce and dairy throughout the county.
And I will tell you wholeheartedly that Ashtabula County is very much a can-do county. We help each other.
Ask, what can I do for my community? What can we do as a community to get the care we need for the people we love?
A lot of the rural hospitals are closing up because they don't have finances.
I mean, this is like almost a third world country with medical care because we have no hospital.
And I thought, how many people has this affected? How many families like us that it was too late for.
Because all the players in the system are big, complicated businesses.
And I just felt helpless and hopeless. Like there was just nothing that I could do.
It's difficult to recruit anybody here, just because there isn't much to offer.
Oh, that's horrible to have to tell your kid, you know, no.
The Appalachian region has had historically high rates of poverty that have persisted across decades.
I just feel like more needs to be done here.
SNAP, in many cases in these hard-hit neighborhoods, it artificially pumps up these stores that might not otherwise be able to stay in business.
You don't want to say like ghost town, but it's hard. I can't see it getting any better. I really can't.
People come to the Delta, they spend time in the Delta, and then they become transient and they leave and they go somewhere else.
Voices crying for help, crying for access to health care. Voices who simply want a doctor close by, a hospital or clinic to treat their dying relative, or access to the things they need for a healthy life. Bridging the Great Health Divide has shown you your geographic location can determine whether you live or die. But your location can also sometimes determine whether your plight receives media coverage or political attention. The plight of people who live in the Delta and Appalachia has been largely overlooked on a national scale for decades. Bridging the Great Health Divide is a project by us here at this TV station and our parent company, Great Television. As you saw, the stories we showed you reach different parts of these regions and include a range of topics. But for nearly every interview, every voice you've heard, we ask one question to nearly every person.
Why should people in other communities where they have their doctors or bigger urban cities, why should they care about this?
I mean, rural America makes up a pretty big chunk of America too. It's definitely, in the last 20 years, been on a major decline.
Why should they care about this? Why is this important?
It's important because we all are stakeholders. Everyone is. A healthy community needs healthy people in the community, and if people can't get the resources that they need, then we're all going to suffer.
And unfortunately, we haven't really historically thought about systems of care when we think about medicine. We think about some cool new technology or some great new medication, and we innovate on that stuff all the time. We haven't really innovated on systems. How do we make sure that everybody gets the care they need?
I think that putting more responsibility in the patient is a way to give some healthcare solution. Make people own their disease. Don't just be a diabetic, own your diabetes. I think that educating our population is one of the biggest bridges.
Meet the standards of the program and buy a few healthy items, and I don't think that that's too much to ask.
How are we any less deserving of a place, a safe haven, to keep people alive than people in other communities and other towns? And how many other towns in our nation are like us? How many other people have been forgotten or just kind of dismissed?